when we talk about these new guidelines for overweight and obesity, they do not apply to any child under the age of 2. And when you talk about prescription medications or bariatric surgery, that is pretty clear. That's for 12 years of age and up in terms of medications, and 13 years of age and up in terms of bariatric surgery. So first, let's talk about how we make a diagnosis of a child who is overweight or obese. So we use something called BMI, body mass index. In the pediatric population, that is dependent on sex and age. And for the purposes of making a diagnosis of overweight, that is a child or teenager who is at or above the 85th percentile for their age and sex. When you talk about obesity, it's at or above the 95th percentile for their age and sex. When a doctor or a medical professional suggests prescription medication or even bariatric surgery to deal with a problem of weight, there are a couple of things that I would encourage people to consider. Number one, this does not mean that you as an individual or the child is lazy, unmotivated, not dedicated, not committed, or even, doing the wrong thing. We have to remember that these conditions of overweight and obesity are complex. There are multiple factors involved in causing these conditions, and those include genetic issues, environmental issues, behavioral issues, metabolic issues, hormonal issues. A lot of times a patient may be on a medication to treat something else that may be what we call an obesogenic medication, meaning we know that a side effect of that medication is weight gain. We still have to give that medication because we have to treat the condition that it's being prescribed for, but then we also have to deal with the weight gain that comes along with it. So multiple factors involved in causing obesity. Therefore, it is a complex disorder to treat. It's not as simple as eat less, move more. So if a healthcare professional recommends medication or surgery, especially in this age group, the other thing that I think is very important to remember is that we have 20 to 30 years of clinical practice experience and published peer-reviewed data on safety and efficacy of medication and surgery, even in adolescents and teenagers. The last thing that I think is so important for parents in particular to understand is that if weight loss medication or bariatric surgery is recommended, you have to balance the risk of those treatments, medication or surgery, against the risk of not treating the condition of obesity or severe obesity in a teenager. And we know conclusively what those risks are. Cardiovascular disease, metabolic syndrome, psychological conditions like low self-esteem, depression, anxiety, and musculoskeletal issues, along with an increased risk of certain types of cancers. So when you balance the low risks of medication or surgery against the much higher risks, short-term and long-term, of that list that comes along with obesity and severe obesity, that's when it becomes much easier to make a decision about management or treatment.